Now imagine the same injury more than 2,000 years ago in the mountains of ancient Peru. Against everything we would expect, many patients survived. There were no antibiotics, no anesthetic drugs, or metal surgical instruments. Ancient surgeons relied only on carefully crafted stone tools. By modern standards, such an operation should have ended in death. Yet archaeology tells a different story. How was that possible?
The answer lies in the Andes of Peru, where archaeologists uncovered the world's largest collection of ancient trepanned skulls. For decades, biological anthropologist John William Verano of Tulane University examined more than 800 skulls bearing clear evidence of trepanation, a procedure in which an opening was deliberately created in the skull. No other region has produced such a large collection, making Peru the most important source for understanding this ancient practice. Some skulls contain a single opening. Others reveal several operations performed during the same person's lifetime. In a few extraordinary cases, archaeologists identified as many as 7 healed openings in one skull. Did these patients survive? The answer is written in the bone itself. When a person dies during or immediately after surgery, the edges of the opening remain sharp because the body has no time to repair the damaged bone. If the patient survives, new bone forms around the wound, leaving smooth, rounded edges over time. Many Peruvian skulls show extensive healing. Some recovered so completely that the patients must have lived for many years after the operation. These discoveries challenged a long-standing assumption about ancient medicine. Trepanation had often been dismissed as ritual or desperate experimentation. Instead, the evidence suggests that ancient surgeons developed practical techniques through generations of observation and experience. Instead of steel scalpels or powered drills, they relied on carefully crafted stone tools capable of scraping and cutting away thin layers of bone. Rather than forcing their way through the skull, they gradually removed the bone, reducing the risk of damaging the protective membrane surrounding the brain. The cutting patterns preserved on the skulls show that these techniques continued to improve over many centuries. Why perform such a dangerous operation? Ancient Peru experienced frequent warfare fought with sling stones and heavy wooden clubs. Unlike arrows or spears, these weapons often fractured the skull without killing the victim immediately.
Broken bone fragments could press against the brain, increasing pressure inside the skull and turning a survivable injury into a fatal one. Removing broken bone fragments may have relieved that pressure and reduced the risk of further injury. Archaeological evidence strongly suggests that many trepanations were performed to treat traumatic head wounds, rather than for purely ritual purposes. Researchers compared hundreds of trepanned skulls from different archaeological periods across Peru to answer a crucial question: how often did patients survive? The results revealed a clear trend. Survival rates improved over time. Early operations often left larger openings and showed more signs of complications. Later procedures became increasingly precise. Surgeons placed openings more carefully, caused less unnecessary damage to the skull, and left behind far more evidence of healing. Biological anthropologist John William Verano concluded that surgeons in ancient Peru steadily refined their techniques over many centuries, learning from the outcomes of previous operations. They learned which parts of the skull were safer to approach, how much bone could be removed, and how to avoid injuries most likely to prove fatal. Some skulls display rough openings with fractured edges, while others show smooth, circular openings, providing visible evidence of how those techniques gradually improved. Neurobiologist Charles George Gross, known for his work on the history of neuroscience, reviewed archaeological evidence from Peru and other regions. After examining the available research, he concluded that survival after trepanation was remarkably high. Depending on the period and the surgical technique, An estimated 50 to 90% of patients survived. Even by modern standards, those figures are extraordinary. Several factors may explain this remarkable success. Many patients had already survived the initial head injury and were strong enough to undergo treatment. They also appear to have developed a practical understanding of skull anatomy. Many openings avoid the narrow grooves that contain major blood vessels and instead appear in areas where the risk of severe bleeding was lower, suggesting that safer approaches were identified through experience. High-resolution medical scans now allow researchers to examine healed bone, surgical openings, and signs of infection without damaging the skulls. These studies confirm that many patients survived not just for weeks, but for months or even years after surgery. Some individuals even underwent more than one trepanation during their lifetime. That raises an even more intriguing possibility. If some patients returned for additional treatment, they must have trusted the people performing these procedures. Communities would not repeatedly allow surgeons to operate unless enough patients had recovered to establish a reputation for success. These surgeons had no microscopes, specialized instruments, or formal medical schools. Yet they observed outcomes, refined their techniques, and passed practical knowledge from one generation to the next. Trepanation, however, was not unique to the Andes. Archaeologists have identified similar procedures in ancient Europe, Africa, Asia, and parts of the Middle East. Although these cultures were separated by vast distances and long periods of time, they independently developed the practice of opening the human skull. Some operations were probably performed to treat traumatic injuries, while others may have reflected cultural or spiritual beliefs. Peru remains the best documented example of ancient trepanation because no other region has preserved such a large collection of healed skulls. That exceptional archaeological record allows researchers to trace the evolution of surgical techniques across many centuries instead of relying on only a few isolated examples. As civilizations became more complex, the practice of opening the skull never disappeared. In ancient Greece, physicians such as Hippocrates described surgical treatment for severe head injuries. They recognized that skull fractures could become life-threatening and recommended removing damaged bone when necessary. Centuries later, Roman surgeons refined similar procedures using improved metal instruments. Knowledge once passed from one healer to another gradually became part of written medicine. Practical experience was recorded, studied, and refined rather than relying solely on oral tradition. The word trepanation itself reflects that history. It ultimately comes from a Greek term referring to a tool used for boring or drilling. Over time, the name came to describe the procedure rather than the instrument.
Today, surgeons usually perform a craniotomy, an operation in which part of the skull is temporarily removed under carefully controlled conditions to reach the brain. Although the terminology has changed, the underlying principle remains the same. Sometimes, treating the brain requires first passing through the skull. Modern brain surgery takes place in operating rooms equipped with advanced imaging, precision instruments, sterile environments, and teams of highly trained specialists. Ancient surgeons had none of those advantages, yet they confronted the same fundamental challenge: treating the injured brain while avoiding further harm. The healed skulls of ancient Peru preserve the story of centuries of practical knowledge, built long before medicine became a formal science. When we think of brain surgery today, we imagine sophisticated hospitals and advanced technology. Yet its story began thousands of years ago in the mountains of Peru, where skilled hands and carefully crafted stone tools gave wounded people a chance to survive.
Modern medicine is simply the latest chapter in a story that began thousands of years ago with observation, experience, and the determination to save lives.